Bismillahirrahmanirrahim. This lecture is about the benign epithelial tumors. Just a brief overlook of these four entities, namely seborrheic keratosis, acanthosis nigricans, fibroepithelial polyp, inclusion cyst. Inclusion cyst can be asked, especially in the MCQs. Baki inclusion cyst, usually we pathologists and cytopathologists we usually came across the cases of inclusion cyst in our routine life. Seborrheic keratosis, it affects the middle age to older people, and usually it is distributed on head and neck areas, trunk and extremity. A mutation in fibroblast growth factor receptor 3 is present in the case of this seborrheic keratosis. There is a very important sign that is called as a lesser trilat sign that is seen in case of seborrheic keratosis. In this lesser trilat sign, seborrheic keratosis may suddenly appear in large number as a part of some other neoplasia or as a part of paraneoplastic syndrome, and it occurs due to stimulation of the keratinocytes by this fibroblast growth factor or transforming growth factor alpha. So this is lesser trilat sign, and एक नंबर का शायद पूछा जा सकता है ये OSPI में, what is lesser trilat sign. So it is the stimulation of these keratinocytes as a result of growth factors like fibroblast growth factor, like transforming growth factor alpha, and as a result of this stimulation, seborrheic keratosis can appear as a part of various paraneoplastic syndromes. On gross appearance, the lesions, they are rounded, flat, coin-like, and they have waxy plaques. The size varies from millimeters to centimeters, and the color, it also varies from tan to dark brown in color. And a very important thing is that seborrheic keratosis lesion, it has velvety to granular surface. It is sharply demarcated from the adjacent epidermis. If we talk about the microscopy of the seborrheic keratosis, they are sharply demarcated and exophytic lesion, and this microscopically it consists of sheets of small cells, and these small cells, they resemble the basal cells of the normal epidermis. Variable degree of melanin pigmentation, it can be seen, and second important thing is hyperkeratosis, which is increased or exuberant keratin production that occurs on the surface of the lesion. And one important feature is horn cyst. Horn cysts, these are small invaginations which are filled with the keratin, or you can call them as keratin filled cysts. So दो तीन चीज़ें, एक तो sheets आ जाती हैं इसमें small cells की, which resembles the normal basal cells. Second is the melanin pigmentation that can be seen, hyperkeratosis or increased production of the keratin, and that increased production of the keratin, it can result in the formation of the keratin filled cysts, which are called as horn cyst. So this picture, it shows the horn cyst. You can see these rounded structure, and these rounded structure they are denoted by H, and these cystic cavities, they contain these laminated keratinous material. So these are the horn cyst, which is a very important classical feature of seborrheic keratosis. Next is acanthosis nigricans. What happens in acanthosis nigricans? It is basically not itself is a disease entity. In fact, it underlies the presence of various other conditions. What happens in acanthosis? The skin, it becomes thickened and hyperpigmented and attains a velvety texture. It is present on the flexural surfaces, especially axilla, skin folds of the neck and groin. In 80% of the cases, this acanthosis nigricans, it has a very strong association with the diabetes mellitus. It can also occur with obesity, various pituitary tumors, tumors of the pineal gland, and in remaining cases it can occur with the gastrointestinal adenocarcinoma. But in 80% of the cases, it is associated with various benign conditions. ये सारी benign conditions हैं diabetes, obesity, pituitary tumor, spinal gland tumor. So yes, ये पूछा जा सकता है OSPI में कि write the associations of the acanthosis nigricans. तो उसमें you will can write these important associated conditions which in which acanthosis nigricans is seen. If we talk about the mutation in acanthosis nigricans, there occurs the activating mutation of the fibroblast growth factor receptor 3, and this fibroblast growth factor receptor 3, this is a receptor tyrosine kinase. What happens in the diabetes? The hyperinsulinemia, it causes increased stimulation of the insulin like growth factor. और इसके अलावा इंसुलिन लाइक ग्रोथ फैक्टर के अलावा फाइब्रोब्लास्ट ग्रोथ फैक्टर रिसेप्टर 3 की एक्टिवेशन भी हो जाती है, दैट इज अनदर रिसेप्टर टायरोसिन काइनेज. सो दीज आर द टू इवेंट्स that are associated with the acanthosis nigricans, especially in diabetes. Similarly, in few cases, high levels of transforming growth factor alpha, they can also be linked to result in the development of this condition. मॉर्फोलॉजी बड़ी प्यारी सी मॉर्फोलॉजी होती है. इसमें रिपीटेड पीक्स आ जाती हैं एंड वैलीज आ जाती हैं, अल्टरनेटिंग पीक्स एंड वैलीज, क्रेस्ट्स एंड ट्रफ्स आ जाते हैं. यू कैन से यू रिमेंबर फिजिक्स, उसमें कहीं था कि साउंड की वेवलेंथ में था क्रेस्ट्स एंड ट्रफ्स. और सिमिलरली इन acanthosis nigricans और माइक्रोस्कोपी यू कैन सी peaks and valleys. Along with these peaks and valleys, you can see hyperkeratosis and basal cell layer hyperpigmentation. So this is the photomicrograph of acanthosis nigricans. You can see that there are various peaks of this squamous epithelium, and the peaks, they suddenly dip downwards, resulting in the formation of the troughs or the valleys, and these valleys or these troughs, they are filled by this keratinous material. So this is the classical photomicrograph of acanthosis nigricans. नेक्स्ट इज अ फाइब्रोएपिथेलियल पॉलिप. फाइब्रोएपिथेलियल पॉलिप के बहुत सारे नाम हैं और कॉमनली वो यूज टू कॉल इट एज स्क्वेमस पेपिलोमा, स्किन टैग भी इसे कह सकते हैं. सो इट इज़ यूजली सॉफ्ट फ्लैश कलर्ड और एंड इट कैन मिमिक वेरियस ट्यूमरस कंडीशन. वॉट की तरह भी, स्क्वेमस वॉट की तरह भी यू कैन फील इट दैट इज, यू कैन मिसडायग्नोज इट दैट दिस इज on gross examination that this is fibroepithelial polyp. So वाट की तरह का भी हो सकता है, सॉफ्ट भी हो सकता है, स्पंजी भी, फ्लैश कलर्ड. इट इज़ अटैच्ड टू द स्किन बाय स्लेंडर स्टैक. और जब भी पॉलिप आ जाएगा तो उसमें दो चीज़ें इंपॉर्टेंट हैं. वन इज़ द लाइनिंग एपिथेलियम एंड सेकंड इंपॉर्टेंट थिंग इज़ द फाइब्रोवास्कुलर कोर. फाइब्रोवास्कुलर कोर वी मीन द फाइब्रस टिश्यू एंड द वास्कुलर टिश्यू दैट इज़ प्रेजेंट इन द सेंट्रल पोर्शन. सो और जो पहली इंपॉर्टेंट चीज़ मैंने बताई थी उसकी एपिथेलियम. सो फाइब्रोएपिथेलियल पॉलिप दैट इज कवर्ड बाय स्ट्रेटिफाइड स्क्वेमस एपिथेलियम. So this is a photomicrograph of the fibroepithelial polyp. Just see on the outer surface there is stratified squamous epithelium. This is a polypoidal tissue that is covered by stratified squamous epithelium. और उसके beneath अगर देखें हम उसके कोर में या उसके स्ट्रोमा में, you can see the fibrous tissue and you can see these abundant blood vessels, these whitish channels, these small whitish channels, these are the blood vessels. So किसी भी अगर पॉलिप को डिस्क्राइब करना हो तो उसमें जो दो चीज़ें इंपॉर्टेंट हैं, मैं बार बार बताया है, एंड दोज टू थिंग्स दे आर द लाइनिंग एपिथेलियम एंड द अंडरलाइंग फाइब्रोवास्कुलर कोर. सो दिस इज द फाइब्रोवास्कुलर पॉलिप और यू कैन आल्सो कॉल इट एज स्क्वेमस पेपिलोमा. Next is inclusion cyst. Inclusion cyst that is formed by the invagination of epidermis. When the epidermis or the squamous epithelium it invaginates, it may result in the formation of the cystic cavities which expand, and those cystic cavities they may contain the keratinous material, and when they expand to so much size that they may result in the formation of these inclusion cysts, and sometimes these inclusion cysts they can get infected also. So this is a photomicrograph of the inclusion cyst. You can see that there is a continuation of the squamous epithelium and suddenly it dips downward, and ultimately when it dips downward, the upper end of this these invagination they fuse together and result in the formation of a cystic space, cystic cavity, and this cystic cavity it becomes filled with the keratinous material. So these are the inclusion cysts. और inclusion cyst की सबसे इंपॉर्टेंट बात यह है कि दे कैन बिकम इन्फेक्टेड, और इसमें इसको जब हम एस्पिरेट करते हैं थ्रू नीडल एस्पिरेशन, तो इसकी बड़ी एक टिपिकल सी स्मेल आ रही होती है कि व्हेन यू एस्पिरेट एंड व्हेन यू स्प्रेड द स्मीयर ऑन द स्लाइड, तो आपको उसकी स्मेल से ही पता लग जाता है दैट दिस इज द एपिडर्मल इन्फ्लुएंस सिस्ट और इन्फ्लुएंस सिस्ट। सो दिस वाज द लेक्चर, टुडेज़ लेक्चर, जिसमें ये 2-3 छोटी छोटी चीज़ें डिस्क्राइब की गई हैं। इसमें पहले बता दिया है कि इन्फ्लुएंस सिस्ट के बारे में कि दिस इज़ इम्पॉर्टेंट, बाकी 1-2 इसमें ऑस्पी क्वेश्चन हैं आपके लिए, जस्ट गो थ्रू कर लीजिएगा। इन नेक्स्ट लेक्चर वी विल डिस्कस द मेलानोमा। मेलानोमा इंपॉर्टेंट है SCQs के हवाले से भी, MCQs के हवाले से भी, और ऑस्पी के हवाले से इट इज़ वेरी इंपॉर्टेंट।